An estimated 85,000 elderly South Africans have died from COVID-19 related complications since May last year. Most of the elderly people that have died are over the age of 60, and many are still breadwinners. Now, the South African Medical Research Council believes most of these deaths are due to COVID-19 infections. Joining us now to speak to us about this is Professor Debbie Bradshaw. She is she's the head of the Burden of Diseases Research Unit at the South African Medical Research Council. She talks to us from Cape Town this morning. Prof, thank you very much for your time. I want to start here. The country's estimated death toll in its totality as things stand right now, it's about just over 40,000 people that are known to have died due to COVID-19. You are now coming up with this figure of 85,000 people over the age of 60, and you're saying that in all probability, they died as a result of COVID-19 complications. Am I capturing the essence here correctly?
Xoli, you're absolutely capturing what we are seeing. The official confirmed COVID cases, deaths from COVID, we think are largely the deaths that occur in hospitals and get reported very easily through to the Department of Health. What the MRC has been tracking since March last year is the number of deaths that get registered with the Department of Home Affairs. And we've made slight adjustments to those numbers to account for the fact that we're getting only the people who have a South African ID number, and also that not every single death in South Africa gets registered. And what we've seen in December and January is this relentless increase in the number of deaths that have been registered. And we've translated that into what we call an excess deaths when we compare it against the number that we would have expected if the trends from the previous years had followed. So that 85,000 deaths of older persons, people over the age of 60, many of whom, as you say, are breadwinners, that has been our comparison with what would have been predicted if previous years' numbers had occurred.
Yeah. It's very concerning, Prof, and I have got to ask you then, are you in communication, as I would imagine you are, with the National Department of Health, which regularly releases these numbers, in fact, on a daily basis, of people who've succumbed to COVID-19? Because if this is the case, and you are as confident as you are that these elderly people have succumbed to COVID-19 is as a result of COVID-19, surely then that total figure of people who've died of COVID-19, which now sits at just over 40,000, that needs to be corrected.
We are in constant communication with the Department of Health and the Minister. We are not 100% confident that every one of those excess deaths is COVID related. We don't have information to tell us exactly what the cause of death has been. But what we do see is a very tight correspondence in the timing of these increases with the surge in COVID cases that has been reported across the country. sort of starting in the second wave, starting in the Eastern Cape and then being followed in the Western Cape and KwaZulu-Natal. So the timing and correspondence of the increase in excess deaths has been exactly along the lines of the spread of coronavirus. Yeah. So our interpretation is that the majority of those deaths, not necessarily all of them, but the majority of those deaths must be related to the pandemic.
Yeah. Prof, I'm sorry to interrupt you there. I want to capture your first response. You said that most of the cases that are captured in hospitals as COVID-related deaths, it's easier to do that because those people have been able to reach hospitals. Is the implication here that these elderly people, and you speak primarily about provinces that are largely rural, are you saying that most of these people whose condition at the time of death may not have been captured correctly is as a result of them dying at home?
We think a large number of those, the gap between our figures of excess deaths and the confirmed COVID, we think that a large proportion of those must be deaths that have occurred at home before people have got to health services. We know that COVID can set in very quickly before people realize how serious it is. And also during the height of the surge, we think there may be, if hospitals are full, perhaps people are not getting into the health service.
Sure. And that's a devastating figure there, Prof. But more devastating that we mention in that intro that these are breadwinners. We know that grandmothers who are in rural parts of our country are looking after children of their children who may have already passed on, and they effectively become the parents to these children. The impact of this, are we seeing any results already of almost child-headed homes, if you like? And when is this, in your view, likely to reveal itself as time goes?
So I think, the second wave has been very punishing. I think that, we survived the first wave and were suddenly overwhelmed with the second wave. It appears that the virus has changed and has become much easier to spread from person to person. So the second wave, and especially over December, January, with the very traditional movement of South Africans back home, and then after January to come, to move again, that has really made the second wave just so much bigger in impact. Yeah. And I don't have access to data or any information on the consequence of this, but I do believe it's going to be noticeable.
Professor,
but it's together with the lockdown that we have that's making the economy much, stretching and affecting the economy. So there are a lot of things happening in South Africa at the moment.
Professor Debbie Bradshaw, head of the Burden of Disease Research Unit at the South African Medical Research Council. Thank you very much for your time. I'm very sad to not be able to ask you this question, but I'll put it to other experts because of time constraints. I'm very sorry indeed, but thank you very much for having this important conversation with us.